I want to take a couple minutes and talk about spinal damage, injuries that happen in your spine. Now, when it comes to spinal injuries, the biggest structures that you have to worry about on the spine, I have my model here, and this is the spine, and just so you understand, these right here are the vertebra, and between each vertebra you have these yellow nerves. Those are the nerves that come out between the vertebra, each vertebra, and then the yellow part here is the disc material. Now, those discs allow for your spine to move. Now, what can happen when you injure yourself, you can get one of these things. Now, that is a disc herniation or disc bulge. So you hear disc bulge, disc herniation. In the old days, they used to say you have a slipped disc. Typically, there's nothing slipping. What's happening is your disc is injured. It starts to bulge out, inflammation occurs, and it starts pressing on the nerves coming out of your spine. What's that going to feel like? Well, when you start getting that, you're going to start experiencing back pain. And because you have pressure on the nerve, and the nerves, especially in the low back, those nerves go down into your legs and feet. So you can have numbness, tingling, pain, shooting pain into your legs, feet, sciatica, those kinds of issues coming from a disc bulge or herniation in your low back. Now, you can also get disc herniations in your neck. And when you get them there, what you start noticing is you'll get neck pain, of course, but also you can get radiation down into the arm and hand, into different fingers, to your shoulder, into the upper back area. So if you have any of those symptoms, it could mean that you have a herniated disc or a bulged disc. Now, the interesting thing is you cannot see a bulged or herniated discs on x-rays. What you need is an MRI. So when you get an MRI, they'll tell you have mild, sometimes they'll say mild, moderate, severe herniation or bulges, sequestration, words like that on your MRI report, on your radiology report. And that just means you have various grades or the size of the bulge or how big that bulge is. The bigger sizes, depending on which MRI place you go to, some places actually rate it and they'll tell you how many millimeters it is. Typically in the low back, depending on your anatomy, you might be able to handle up to 5 or sometimes 6 millimeter bulge without necessarily feeling it. Some people have so much space that they have room for that. Other people have a very tight architecture in their spine, and when they get those bulges, even a smaller bulge, they start experiencing symptoms very quickly. These are things that can be handled conservatively. You don't always need to jump to a surgery, and those are things that I've handled for many years, and they're absolutely things that can be taken care of conservatively, and that's the approach that should be taken first. And then, of course, if that doesn't work, you can always fall back on drugs and surgery if you want that later. Anyhow, I think I've done enough time on this video, so I'm going to leave the next video on some other spinal injuries to a different day. So hopefully you learned something today from what I taught you on disc injury in the spine.